Specialist palliative care operates under standards and accreditation. These guide staff and volunteers to help them understand the core focus and limitations of palliative care. In this sequence, we outline the 2018 National Palliative Care Standards and the key priorities of the New South Wales End of Life and Palliative Care Framework 2019 to 2024. Our National Palliative Care Standards, we're up to the 5th edition, 2018, came out of Palliative Care Australia. They've given us 9 national standards, and they've given us a language to describe the quality of care. The first standard is about assessing a person's needs. How do we do that? We look at their physical, psychological, spiritual and social needs. The second standard is about supporting families to make decisions about their care goals. The third standard is about the family's needs. So it's important that palliative care staff assess those needs so that they become part of the care plan as well. Standard 4, care, is based on the values and goals of the person that we're caring for. It's evidence-based and it's documented in their care plan. Standard 5, care is integrated with seamless transitions between care points. Standard 6 is about carers receiving bereavement counselling and support. Standard 7 is about person-centred care. It takes in the person's culture, their beliefs and their values. Standard 8 is about services engaging with research so that services are developed and enhanced through research and evidence. Standard 9 is about the staff and the volunteers. And what we need to do with staff and volunteers is support them, continually educate them, and make sure that they have the right training. Concord Palliative Care Unit is a specialist palliative care inpatient facility in Sydney. This video demonstrates what it looks like to put the National Palliative Care Standards into practice.
Palliative care is extremely important. The main aim of palliative care is really to improve patients' quality of life. The most important thing is helping patients live with their disease and live right through till the end. So I think for the patients of the Sydney Local Health District, it's so important to provide this importance on quality of life.
I think that it's because we look after the patient and their family in quite a holistic way, so that they get to come to a centre that hopefully feels a little bit like home, and we try to support them as individuals and not forget that they still have value.
Over the 5 years, apart from the core work that we do, which is doctors and nurses coming together with allied health staff such as social workers, OTs, physios, we've also developed an amazing complementary package of care as well, included with our volunteers. And they, really form a significant part of the palliative care team.
I think the energy in this centre is quite special. I think that the fact that the patients have a room individually that has a courtyard and they can look outside and they can see if it's raining today. We have a barbecue so that if families traditionally have a barbecue on a Sunday, they can continue to have a barbecue on a Sunday. It's just at the centre here. So we try to bring normality into the centre. We have a living room, we have a little kitchen area where people warm up their meals at night and share a meal together. So there's lots of things that we can do with the patients that remind them that they're still of worth.
Part of traditional care that's missing in the hospital is all of these complementary things. So as a service, we've really grappled with and thought, what are these extra things that we can provide for our patients? We've been able to fundraise for the Jolly Trolley, to have alcohol for our patients, to employ an art therapist as well as a musician. So one by one, we've slowly built these extra complementary therapies.
In New South Wales, we are also guided by a state framework called the New South Wales Health End of Life and Palliative Care Framework 2019 to 2024. There's 5 key priorities. The first is person-centred care. The second, recognition and support for the families. 3, access to skilled care providers. 4, coordinated and integrated care. And 5, equitable care. Let's just go back over what we've learnt in sequence 3. Prior to the standards, there was no structure. The standards are so important. They've helped us with evidence to inform policy, and they've helped to deliver the best quality care, which quite frankly, we all deserve. Australia now has a reputation for having high quality palliative care.